Hello, I'm Paul Au. I'm a dentist at Essential Dental Care in Edinburgh. Due to the lockdown caused by the coronavirus, routine dental services have been suspended. I'm here to answer some of the questions that you may have during this challenging time. Although we are unable to provide any routine dental treatments, we have finished our new website, so please check it out. We are also working on a retail page that you can order essential dental products from directly. In addition, we are rearranging our surgeries to provide an even safer environment for dental treatments to be carried out. We look forward to welcoming you back in the very near future. We're planning to do this question and answer session every Wednesday, so please send your questions via text, email, Instagram, or Facebook. The details are as below. Okay, now let's address some of the dental concerns when to seek urgent dental care. If you have facial swelling, severely broken tooth, bleeding due to trauma, toothache that is not relieved by painkillers, and disturbing your sleep, in any of these cases, please call the practice 0131 229 1806 or 111. However, go straight to A&E if you have a facial swelling disturbing your vision and your breathing, and also preventing your mouth opening by 2 fingers width. The other concern I have been asked quite often is what to do if you have a chipped tooth, a broken filling, or a lost crown. The most important thing is to try and keep the tooth as clean as possible. So you should brush well, and also at the end of the day, maybe use warm salted water to rinse your mouth out to get rid of as much debris as possible. If you find the edges of the tooth is cutting into your tongue or the tooth is getting more sensitive, then it may be an idea to use a piece of sugar-free chewing gum as a quick temporary measure, or you can get from your local pharmacist a temporary dental dressing. You should also give us a call and we will try and arrange an appointment to see you as soon as we can open to address the problem. So goodbye for now, stay safe, keep well, and see you next week.